This muscle, but here we have only half of this muscle. Musculus trapezius. Superficial muscle. What is the function of this muscle?
To contraction, to move.
Yeah, this one contraction.
What does it mean? Scapula. When is scapula fixed, it turns our head. This one is latissimus dorsi. Latissimus dorsi. This, the second flat big muscle. What is the function of it?
To hold the scapula.
Adduction.
To adduction of the
upper limb, because it attaches to the upper limb. Below these muscles,
Set up, blood supply and innervation.
serratus,
superior, inferior,
posterior, superior, and serratus anterior will be on the chest. And these two muscles attached, they have a shape of scales and attached to the rib. They help in respiration, movement, in and exhalation. But here we can see a little muscles. Rhomboidus. This is rhomboidus major. Rhomboidus major here should be. Oh no, it. I think it is trapezius. Remnants of trapezius. Rhomboidus major and minor above must be. Musculus rhomboidus between spinous processes of vertebrae to the medial margin of scapula. Function to move the scapula medially. What else can we find in muscles of the back? Rhomboidus.
minor and minor.
Rhomboidus, yes. This rhomboidus.
Cervicalis scapula.
Levator.
Levator scapula. Levator scapula attaches to the angle of the scapula and to the neck. Function we can see from the name levator scapula, to elevate, to raise the scapula. What else? The next muscle? Rib muscle, yes.
Musculus planus.
Capitis and cervices in the neck. Yes, to turn our head. What else? What is this?
Mana ada api lah.
Musculus erector spinae. Musculus erector spinae. It consists of many bundles. Yes, but the whole function is to hold our back, spine our back vertically. What type of bundles does it contain? Musculus erector spinae. It consists of several bundles. Musculus iliogastalis. Musculus longissimus. And musculus spinalis. And musculus spinalis. Musculus spinalis. What else from the deep muscles can we have?
Musculus
Transversus spinalis. It is located between transversal process of one vertebra to the spinal process upper vertebrae. It consists of several types of muscles. Musculus transversus spinalis. Function of its rotation in our back, in the spine. It starts from the transversal process of one vertebra, then overlaps several vertebrae and attaches to the spinous process. And depending on the length of this muscle, we can have three types. we have semi-spinalis, multifidi, rotatorus, depending on the quantity of overlapping vertebrae. Semi-spinalis, 4 vertebrae overlaps. Multifidi, maybe 3 vertebrae, 2, and rotatorus to next from one vertebra to the other vertebra, short muscles. The function of them to rotate our vertebral column, yes. And deeper we have as well short muscles. Like ligaments. Intertransversale. Transversus process. What else? Interspinale. Suboccipital, which is the short muscles in the same direction, but only below the occipital bone. Deep muscles of the back, these are autochtonic muscles. They develop on the back and they have a metameric structure. They are located segmentally. They attach to the vertebrae and perform the movements in the vertebral column. Deep muscles, main function, they are autochtonic, develop and grow and work in connection with the spine, with the back.